Hello friends, I'm Smitha. Welcome to SmartDiv. Know your body more with fact and tips. Today's topic is human blood, part 1. So what this video contains? What is blood? Interesting fact about blood. What is there in the blood? What does blood really do? Blood grouping, blood transfusion, condition and treatment related to the blood, health tips. Now, what is blood? Blood is a fluid connective tissue of the body. Blood connects different parts of the body. Sir William Harvey was the scientist who discovered circulation of blood. Blood is essential to keep us alive. It carries nutrient and oxygen to all the parts of our body and also fight against infection. Hemato related to blood, hematology, study related to blood. Do you know where does blood produces during embryonic stage? That is when the baby is inside the womb. In the beginning month, that is in the yolk sac. And as embryo grows to fetus, blood is produced from the liver and spleen. In adult life after birth, blood is produced from red bone marrow. Now let us see some interesting fact about the blood. A person may lose 40% of their blood and can still stay alive, but timely blood transfusion is needed. 21% of all heart attack happens on Monday. A second peak happens on Friday. Scientists assess that the reason is an outpouring of stress hormone in the beginning of the week. Due to similar compositions, coconut water is able to replace blood plasma. Blood makes up about 7 to 8% of a person's body weight. Blood consists of mostly 55% of plasma and 45% of blood cells. White blood cell is important for pregnancy. Do you know why? White blood cell has macrophages which assist in the development of the blood vessel network in ovary and vital for the production of the hormone progesterone, which plays important role in implantation of embryo, which means white blood cell is important for pregnancy. About 95% of body's blood cells are produced in the bone marrow. In an adult, most of the bone marrow is concentrated in the ribs and in the bones of spine and pelvis. Lifespan of blood cell RBC circulates about 4 months. The lifespan is 120 days. WBC few hours to several days. Platelet 9 days. Mature RBC does not have nucleus, it has millions of hemoglobin molecules. Blood protein protect against carbon monoxide poisoning. People with type O blood are more resistant to cardiovascular disease but at risk to develop skin cancer or suffer from obesity. People with AB blood type, 82% chances are there to develop cognitive impairment. Cognitive means function related to brain. What is there in the blood? Blood is thicker than the water. Its viscosity is 5 times greater than water. Blood mainly consists of 55% of plasma and 45% of blood cells. Plasma contains 91% of water and 9% of solid. Blood cell contains RBC, that is red blood cell, platelet and WBC, white blood cell. Plasma. Plasma is a yellowish liquid. It is single largest compound of the blood, in which various type of blood cells are suspended. There is difference between serum and plasma. Plasma does not contain blood cells. Serum is plasma without some clotting factor. It is the fluid oozing out of the blood clot. Do you know how does plasma works? After the food gets digested, the liquid nutrients will be transported to particular cell by plasma. Do you know pH of the blood is 7.4? Total amount of blood in male is 5 to 6 liter. In female is 4 to 5 liter. Plasma has 91% of water and 9% of solid. Solid, it contains organic 8% and inorganic 1%. Organic, plasma protein, albumin, globulin, fibrinogen, prothrombin, amino acid, glucose, fat and lipid, fatty acid, cholesterol, phospholipid, vitamin, hormones, nitrogenous waste product, urea, uric acid, creatinine, bile pigment, xanthin. Inorganic, sodium, potassium, calcium, magnesium, manganese, and ferrous. Chloride, bicarbonate, phosphorus, sulfate. Blood cell contain RBC, platelet and WBC. RBC, red blood cell. The amount of red blood cell is 5 million per cubic millimeter. Platelet is 2 to 4 lakh cubic millimeter. WBC is 4000 to 11,000 cubic millimeter. RBC are more in number than platelet than WBC. Size and shape of WBC is bigger than platelet than RBC. RBC, red blood cell. Erythrocyte is the other name for this. Protein in the blood is hemoglobin. It is present in red blood cell, which carries oxygen molecule and transport them to various parts of the body. So it gives red color to the blood. RBC dies in 120 days. Every day new RBCs are produced to compensate the lysis. It is produced in red bone marrow. After depositing oxygen to tissue and other organ cells, red blood cells pick up carbon dioxide for transportation to the lungs, where the carbon dioxide is expelled from the body. WBC, white blood cell. It has granulocyte and agranulocyte. Granulocyte means it has small granules. Agranulocyte means there is no visible granules. Cytoplasm with nucleus is present. Granulocyte. It has neutrophil, basophil, eosinophil. Agranulocyte has lymphocyte and monocyte. Neutrophils are 40 to 70%, basophils 0 to 1%, eosinophils 1 to 5%, lymphocyte 25 to 40%, monocyte 2 to 8% are present. Its important role is immunity. It locates and destroys the pathogen and removes it, means the disease causing organisms, and protect the body from infection. Platelet. Platelet also called as thrombocyte. Cell components are formed from pieces of cell found in the bone marrow called megakaryocyte. When we have injured blood vessel, platelets in the blood clumps together to block the opening of the blood vessel. What does the blood really do? First we will see in general, then few points about its component function. Blood, it acts as a transporting agent of the body. It helps in transportation of respiratory gases, transportation of nutrients, transportation of waste product, transportation of hormones, regulatory function, and it helps in defense mechanism. Transportation of respiratory gases, that is oxygen and carbon dioxide. Oxygen is transported from lungs to the tissue by the blood. Carbon dioxide is transported from tissue to the lungs by the blood. Carbon dioxide is also an end product of metabolism, For example, glucose is oxidized and we get the end product as carbon dioxide, which is expelled from the body through the blood from the lungs. Transportation of nutrients, vitamin, mineral, water, fat and lipid, carbohydrate from gastrointestinal tract to various parts of the body. Transportation of waste product. Blood picks up the waste product from the site of production and carry them to the site of excretion. Excretory organs like kidney, lungs, GI tract, that is gastrointestinal tract, and skin. Transportation of hormones. Blood carries hormone from the site of production to the site of action. It's organic chemical substance produced by the ductless gland and endocrine gland. Defense mechanism. It helps by phagocytosis. White blood cells engulf foreign organisms and kill them, producing antibodies to kill microorganisms. Clotting, to prevent blood loss. Regulatory function. pH regulation by acid-base balance, body temperature regulation, water balance, intra and extracellular fluid. Do you know how blood helps to cool the body? When body temperature increases, the thermal energy is distributed between different parts of the body. Blood vessel dilates, blood flow increases. The higher thermal energy is lost from the skin and the body starts cooling. When the temperature decreases, the blood vessel will constrict. Because of this, the blood flow decreases and the thermal energy won't lose much. Neutrophils kills microorganism by engulfing it. The normal value of neutrophil is 40 to 70%. Basophils will secrete natural anticoagulant, which is called as heparin, which prevent vascular blood clotting, that is, clotting of the blood inside the blood vessel. Normal value is 0 to 1%. It helps in fighting against allergic response. Eosinophils, which contains enzyme called as histamine. The normal value of eosinophil is 1 to 5%. Lymphocyte, which gives immunity by T cell and B cell. T cell protect body from viral infection and tumor. B cell protect from bacterial infection. Monocyte, normal value is 2 to 6%. It engulfs dead cell, secretes BPA to increase RBC production. Help in repair of damaged tissue and repair of wound. Platelet, which helps in clotting of the blood. Do you know what happens when you have a wound or if the blood vessel has minor injury? When the blood vessel is injured, the platelet at the site sends signal to brain by pain receptor cell. Cell wall of the platelet are more permeable to water, which makes platelet to bulge and cell wall becomes sticky. Due to this, number of platelet adhere and stick together. This forms platelet plug, which blocks free flow of blood from the cut vessel. Normal bleeding time is 2 to 5 minutes. Normal clotting time is 5 to 8 minutes. When we have injury, first vasoconstriction happens, means blood vessel gets narrowed, and then the platelet plug forms, which means the blood clot at the site. Then clot retraction happens, means broken ends joins together by shrinkage of clot, where platelet helps to repair the blood vessel. Subdermal blood patches is known as purpura. These patches initially appears in red color, then to brown, then to black. What happens when oxygen in our body decreases? Now we will see how our body compensates in this condition. The normal oxygen saturation level in our body is 90 to 100%. If it comes below to it, the state is called as hypoxia, where the oxygen level decreases in our body. In this condition, Kidneys are stimulated. In response, kidneys will secrete renal erythropoietic factor, that is REF. It acts as hormone which influences bone marrow to increase production of RBC, red blood cell. So it has HB, that is hemoglobin, which carry oxygen. In return, our body comes back to oxygenated state where it leads to normal level of oxygen. Blood grouping. There are 4 types of blood groups: A, B, AB and O. Karl Landsteiner, who discovered ABO system of grouping. Identification of these groups is based on the presence or absence of A and B antigen on red cell. Antigen is a protein on blood cell. There is an antibody in the serum. According to Landsteiner rule, if the person has A antigen, then he doesn't have A antibody. Instead, he has B antibody. Same way for B antigen has A antibody. In AB group, it has both antigen AB but no antibody. O group has no antigen but AB antibody is present. Our blood group is determined by genes inherited from our parents. If the mother's blood group is A and father's blood group is A, child may get A or O. Same way, if the mother's blood group is B and the father's blood group is B, then the child may get B or O blood group. If the mother's blood group is AB and father's blood group is also AB, then the child will get A, B or AB. If the mother's blood group is O and the father's blood group is also O, then the child will get only O blood group. RH blood system means identifying the group is positive or negative. If the person has RHD antigen, then group is positive. If the person doesn't have RHD antigen, then group is negative. Means the people may have A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, O negative blood groups. Now we will see about blood transfusion. It is the process of collecting blood from one person and donating to another person. There is a particular criteria, some rules need to be followed. To donate, the donor must be healthy and free from communicable disease like AIDS, hepatitis, etc. The donor's weight must be above 50 kg to determine adequate resource of blood. Age must be 18 to 65 years and he or she must have hemoglobin level, normal hemoglobin level in female 12 to 14 gram per dl, in male 14 to 16 gram per dl. Which blood group to be transfused to whom? Group A person can give to Group A, Group B person can give to Group B. Group AB is a universal acceptor, so they can receive from A, B or O. Group O is universal donor, can donate to any group but must receive only from Group O. Now RH type. While donating blood, RH positive can be given to RH positive only. RH negative can be given to RH negative only. But RH positive should not be given to RH negative. Why blood transfusion is done? To compensate lost blood volume, maybe due to accident or injury, where there is a huge loss of blood, or before surgery or after surgery, before delivery, after delivery, or treatment of anemia, or treatment for blood cancer. What happens if wrong blood grouped blood is transfused? Antigen-antibody reaction happens. Clumping of red blood cells and it gets destroyed. So the total amount of red blood cell will decrease. So it will lead to decreased oxygen level in the body blockage of blood flow, and circulation get affected. If not noticed and timely action has not taken, it may lead to death. Before transfusion, group must be confirmed and the person who is receiving the recipient blood sample to be sent to cross match with the donor's blood sample. Condition and treatment related to blood. Anemia. Hemolytic anemia. RBC produced which matures and then it dies. New one is produced, again cycle repeats, but it has specific days to cover the cycle. In this condition, the cell is removed in premature state from the circulation due to abnormality of or overactivity of spleen. There are two types: congenital, means by birth, and later acquired. Sickle cell anemia. Here, Hb molecules are misplaced, lifespan of the cell is reduced. Due to shape, it does not move smoothly in small blood vessel. Due to this, it may cause ischemia. Thalassemia. It is a kind of anemia where hemoglobin production is reduced and early lysis of the hemoglobin molecule happens. May happen due to some medication, chemicals in the environment, or autoimmunity disorder. Leukopenia. The total number of leukocytes, that is WBC, white blood cell, is reduced, maybe due to chemotherapy or damage to bone marrow or infection. Leukocytosis. Increase WBC count due to protective function. Leukemia means blood cancer. There is immature and malfunctional white blood cells due to carcinogenic reason where the body is easily gets infected. Treatment is bone marrow transplantation, periodic blood transfusion, and chemotherapy. Thrombocytopenia. Condition where there is a reduction in platelet count, also seen in dengue. The bleeding time may be prolonged. Treatment: platelet transfusion. Hemophilia. It is a clotting disorder which has long clotting time. Treatment: injection of deficit clotting factor, periodic blood transfusion. Vitamin K deficiency. Vitamin K is important for clotting of blood. That is, it is a fat soluble vitamin required for synthesis of clotting factor in the liver. Treatment is vitamin K injection or oral medication. Now we will see some health tips for healthy and clean blood. Intake of dry fruits such as date and figs. Intake of green leafy vegetables such as broccoli, green beans, spinach, nuts and seeds. Food with vitamin B12 and folic acid needed for DNA synthesis such as avocado, asparagus, rice, tuna, salmon, fortified cereal. Green leafy vegetable is important for the synthesis of hemoglobin because it has essential iron. Egg, meat and fish, soy product. Food with the vitamin B and vitamin C such as papaya, kiwi, lemon, oranges. Low fat dairy product. Limit tea and coffee. Limit alcohol. Avoid smoking. Stay active with regular exercise. Limit salt and sugar. Skip processed food. Skip high sugar drinks. Body needs rest. Get adequate sleep. Don't sit for long period of time. I hope you enjoyed the video. My upcoming video is about Human Blood Part 2. If you like this video, please do subscribe, like and share to the maximum. Thank you for watching.